dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and my guest today is Dr. Albee Budnitz, and our topic is, what is vaping? Dr. Budnitz, it's a pleasure to have you here, and to have you on the show again after we talked about the tobacco gap. And now so much has been happening that many of our viewers are wanting to know, what is vaping?
Well, first, thanks for having me back, and a lot has happened, and what's in the field now is vaping, and we'll talk about that. So, as you see, what are e-cigarettes? The generic word that we call for all of these devices are ENDS, Electronic Nicotine Delivery System, or ENDS for short. And what an END is a battery-operated device that turns nicotine flavorings and other chemicals into an aerosol, not a vapor. They call it vapor, which is why vapor's in quotations, but an aerosol, which is important because aerosols are what we use to get things deep into the lungs, in a way from a medical standpoint. ENDS are also known as e-cigarettes, vapes, or today it's even become a noun and a verb, Juuls, because that's taken off in the last 18 months or so. We'll talk more about that in a bit. They can look like anything and everything. In fact, there are over 450 brands out there right now and over 15,000 flavorings right now, and it's the Wild West because there's no regulation on them whatsoever.
Where are people getting them?
They can get them, we'll get to that. They can get them online. They can get them in stores. We have a lot of vape stores in Nashville. We'll mention an advertisement from one of them. Hopefully we'll get to that. And they get them from friends. And unfortunately, parents are buying them for their kids, and despite it being a tobacco product, which is illegal if they're under 18, because they think they're safe. And they're not safe, they're not harmless, they are probably less harmful than combustible traditional cigarettes, but they're not harmless by any means. I thought I'd go through the anatomy of an e-cigarette, and this is just a cartoon. An e-cigarette, it contains a battery, a heating element that looks like a coil in the picture, e-juice, that's a picture of juice in the third picture, and then put them all together, and with a trigger of an inhalation, it triggers the battery to heat the coil, then to make the aerosol, which then someone inhales. Another way of looking at it is how they first came out. They look like we call them in the field cigalikes. So they look like cigarettes, and you can see where the battery is and where the processor is that recognizes your trigger, the inhalation, and the heating coil, and then it makes the cloud of vapor. And the first set that came out were like those across the bottom. 3 of those are made, or 4 of those actually are made by the big 4 tobacco companies. Enjoy is one that supposedly was hopefully a harm reduction product, and it's not making the grade right now, either as that or commercially. But Blues and Mark 10s and Views are by 3 of the big 4, and Finn, I believe, is the other. But they look like packs of cigarettes, as you can see. Just a cartoon of how they've gone. They came out, and they could be disposable like the ones on the right, or it looked like pipes or cigars that are refillable and rechargeable. And then they didn't deliver the nicotine, so they took off and then they leveled off. It will give a little history of when they came into the country and all that. And then they looked like tanks, which are the ones in the middle, the size of an iPhone. Then they looked like pens, and finally they looked like flash drives. And these aren't to size in the picture, but like where it says, and those are rechargeable. We'll get into that a little bit more. Here's actual pictures of them. And they came into the country in 2007. This is 2018, and you can see and again, these aren't size specific, but you can see how they developed from things that look like e-cigarettes and things that look like iPhones or tanks in the middle, and that's because they needed stronger batteries to heat the liquid hotter so they could get more nicotine, because they weren't getting the nicotine out of it that they were used to from cigarettes. all kinds of shapes and sizes in the middle. And the latest ones are palm size, although the way I stretched it out on the slide, it's hard to see that. But there's a Juul, which is actually looks like a flash drive, the size of a flash or thumb drive. And then the Juul Me 2s, like the colorful ones that look like eye drops. Then all of these are palm size, so they're easily hidden and easily contained so that people can't see that you're using them. Here's just a picture of all of them. And the big one that came out, went on the market at the end of 2015 is the Juul. And you can see the Juul on the left, and it looks just like a flash drive. And size-wise, I don't have a picture of that, but it can fit inside the palm of my hand very easily, like any flash drive. I thought I'd go a little bit into what vaping vocabulary is. So people call it vaping. Juuls have become so popular. As of last month, they have 72% of the market. In less than 18 months, they've gone from 25% in the beginning of middle of 2016, to now 72% of the market last month. So it's even called Juuling. And some people think they don't vape and they don't use e-cigarettes, they just Juul. But Juul is just another brand of e-cigarette.
So we're talking 2 years. Within 2 years, from 2016 to 2018, it's on the rise.
And so that's exactly right. And so the decline of e-cigarette use, because they weren't as good, as it were, as delivering nicotine as a regular combustible cigarette, has just taken off again in the last 18 months. And it's mostly because of Juul, since they do 72% of the market. Other things you hear about are mods or tanks, and those you saw, the ones that look like iPhones, those were with larger batteries. They can heat the juice hotter, the e-juice as it's called, so that they can get more nicotine out of it, but they're totally not regulated. The result being that you've heard about fires and exploding in someone's pocket, or when they take an inhalation on it, it explodes in their face. I did not include those slides. I didn't think we should put those on TV. Yeah. But that's happened with the mods and the tanks. Cloud chasing is another one word for what they call all the sports they're doing now, as it were. And I put that in quotations, of making huge clouds. You've seen them coming out of cars and other people along the street. Those are vapes, and they can make circles and rings, and they have games to do it. Dripping I'm not going to get into because it's not used very much, but it's a way of taking the device apart to make, again, get more nicotine out of the e-juice that they solidify into more like a pudding, if you will. And they come in a variety of flavors and sizes. So from a historical standpoint, to me, this is, well, I'll get to the next, but over the years, I've changed the talk of when I talk about tobacco from smoking cessation to nicotine dependence disorder in the 90s. And deja vu all over again. We're back to that. A chronic disease, a pediatric disease, a tobacco use disorder. I think tobacco use disorder is the best way to think about it. And so ENDS, the FDA came out, Mitch Zeller, who's the head of the tobacco part of the FDA, just last month with this is a concern that this is the next epidemic and the next generation's problem. And the problem in everything is centered around nicotine. Nicotine is the central focus because that's what makes people keep using these products, just like it makes them keep using any tobacco product. Any nicotine that is derived that you want to make a profit out of has to come from tobacco because it's too expensive to synthesize. But out of a tobacco plant, you can get it easily, and it's extremely cost effective. So anything that has nicotine is probably made from a tobacco product. So I call this, what I've been talking about, maybe just because it's World Series time, is deja vu all over again. Yogi Berra was a catcher for the Yankees when they won 1 million World Series in a row, and I was a Red Sox fan at the time and still am. But he had lots of Yogi Berra-isms, and he was a great catcher, and one of them was deja vu all over again. And if there's nothing else you take out of this today, the 2 points to make is nicotine is central to everything, and they need customers. So it's really exactly the way it was back in the 50s and 60s, where they advertised to get customers, they hook them on nicotine, and then they have a customer for life. OTPs I use as a term for other tobacco products, and there have been lots of other tobacco products out there. Hookahs from the Middle East, we call them water pipes to make it sound better. Those have lots of data to show that they're equally as harmful, if not more harmful, than combustible cigarettes. So it's not just water that you're inhaling. It's a very concentrated tobacco aerosol. Cigars, cigarillos that now look just like packs of cigarettes. The only difference between a cigar or a cigarillo and a cigarette is that cigars and cigarillos are wrapped in tobacco leaf. Cigarettes are wrapped in paper. And then biddies are from India. There's snoo and chew and sticks and dissolvables and all kinds of tobacco products. But the ones, none of them have really caught on, but the ends have. Now included in ends is something called IQOS, which sounds like an iPhone that you see there. And that's a heated tobacco product that Altria, which makes Marlboros, got into and actually has taken over a big piece of about 25% of the Japanese market. They tried to put it through the FDA as a harm reduction product here in the US, and they sent in 1,000 pages last summer and it was denied. So IQOS have not been introduced here, but it's something to look at and be worried about in the future. But what has come along are Juuls, and what I call Juuls 2.0, which means other people see how fantastic they're doing from an economic standpoint. So without any rules or regulations, other companies, big tobacco companies and small entrepreneurs are putting together their own Juul-like devices. So here's a little history of the e-cigarette. 2003, a pharmacist started this in China because he wanted to quit smoking and help his dad quit smoking. So he made this electronic device to get nicotine out of tobacco, and he thought a less harmful way. Introduced a few years later to the U.S., the World Health Organization said it's not a tobacco reduction or smoking cessation product back 10 years ago. We're not so sure now. We were actually ahead of the curve in this state. Breathe, New Hampshire, which I'll mention, you'll see in the bottom right of a lot of the slides, is the oldest voluntary health agency of the state. But anyways, its youth network back in 2010 had a sign into law, and I didn't put the governor's picture. I know it's a political time, but I don't want to get too political. But one of the first 6 states to sign into law that these were illegal for kids under 18 because it's a tobacco product, as all tobacco products have been. The next couple of bullets show that because e-juice, some of these are refillable cartridges and others come self-contained like the Juul, although people have learned how to take it apart. But if they're refillable with e-juice, it can cause poisoning. So there was, when they first came out or first introduced, there was 1 call a month in 2010 to the poison control centers of the country. Over 200 by 2014, and by this year over 2,000. And the reason for that is that if it just looks and tastes and smells like something good, there's over 15,000 flavors, candy, chocolate, desserts, and a little kid, a toddler, gets hold of it. If it leaks and it gets on their hands, they experience the world through their hands. They put it in their mouth, and less than a half a teaspoon has been fatal. So that's an unattended side effect of these, obviously. Coming now, the last 2 years, FDA put out Deeming Regulations in August of 2016. They've never been implemented. And someone wanted to get rid of them in the U.S. Congress and put in a bill to get rid of the Deeming Regulations, having never been implemented. And the compromise was that they wouldn't be implemented until 2022. This is really important, as you'll see the difference of what's happened with ends in our country versus the UK and the EU, which put very similar regulations in place 2 years ago at about the same time. We'll come back to that. Earlier this year, in the spring of this year, the FDA realized that they're getting behind the ball, and they were worried about the kids getting hooked again. Their approach to getting people off combustible cigarettes, that we know are still the #1 preventable cause of death in this country, was having a cigarette that had less and less nicotine in it. And nicotine has been the central part of their approach for the last 1.5 to 2 years. But then they realized that kids were getting on these e-cigarettes and getting the nicotine, and that was an unintended consequence, because it's another whole generation that was getting off combustible cigarettes that are now getting on nicotine, and it still isn't delivered as well as a regular cigarette. So last month they said there was an epidemic. In the spring they told the big 4 companies that they needed to do a better job of keeping kids from getting on these and not advertise to kids. They were going to take action in August about that, having labels put on these products. Nothing has happened yet.
What's holding it up?
Well, I have a personal opinion about that, but it's not based in any fact. But I think that there's a huge tobacco lobby or vape lobby still out there. There's a New Hampshire Vaping Association. There's a national one that are holding this up. And I'm going to jump ahead just so I get the point out there that the Deeming Regulations that the FDA put on and were supposed to be implemented in August of 2016. And then, of course, there was an election in November 2016.
Can you explain deeming?
So deeming just means regulations of tobacco. And things like cannot advertise to youth, cannot have flavors, cannot sell to youth, policy that, a list of policies that have been put together since the 90s. It was very effective in getting 50% of all tobacco users off tobacco from the 90s to the early 2000s. So we were really making headway. Went from 25 to 30% of kids using combustible tobacco, cigarettes, to under 10%. And we were really on our way to making a tobacco-free generation. And everybody felt that it could be there. So these regulations were for ends to try to stem the tide of people getting back hooked on tobacco products. And anyways, they were never implemented. There was an election in November of 2016, and then we almost got them reversed, but at least they're just on hold now. Now, it's interesting. What happened in our country is, without any regulations, as of about 2 months ago, 11 to 12% of all youth under 18 were using ends regularly, meaning at least once in the last 30 days. And New Hampshire was 23.8%, so almost twice that. And in the UK, it's less than 2% as of this month.
Why the difference?
The regulations. So the policy really does work. And we knew that from regular tobacco from the 90s when we put that in. But we just don't have the political will to put that in. In any case, the FDA finally caught up with it in the last couple of months and said, oh my God, kids are using these Juuls all over the place, and we need to do something about it. And they started putting it, like the anti-smoking ads, the anti-Juul ads. I didn't put those in there. They're kind of freaky, although they go well with Halloween, I guess. And Mitch Zeller was just at our annual COOP meeting at the end of last month. And they have since raided this month the Juul headquarters in San Francisco and got thousands of pages of documents to see if they're actually saying what they're saying, which this is just something to get off regular cigarettes, another nicotine replacement therapy, or whether they're really advertising to youth and getting more customers. We haven't heard the result of any of that action as yet. So again, I call this deja vu all over again, and although we haven't got any action on that yet, the vaping industry is marketing to kids because kids are the easiest to get hooked on nicotine because of the developing brain, just as they were marketing to kids in the 1950s and 60s until the Surgeon General's report of '64. And just to show you here, I don't know if you can recognize these folks. And I won't mention about age and everything, but Lauren Bacall and Humphrey Bogart in the upper left, and Steve McQueen in the lower right, and John Wayne and so forth. And that was advertisements from the 50s and early 60s. And this is Johnny Depp, Leonardo DiCaprio, Jack Black, Jenny McCarthy from just this last year. And here's old cigarette ads, again from the 60s, the women's rights movement. You've come a long way, baby, and they made Virginia Slim specifically for women. And I think this is going on its own now. I don't know how that is, but I'll go faster. But these are ads from right now. Fin is a type of e-cigarette. And this is Juul's, and the ad on the right-hand side is actually in Times Square. That if you watch the ball drop and you see that one that goes up and down, that is actually in Times Square right now. And Juul's are opening headquarters, including our administrative headquarters of 16 around the country, including Manchester, New Hampshire. They're coming.
Who owns it? Is it a U.S. firm?
Yeah, so Juul's historically was started by two Stanford students who were smoking and wanted to quit. And that was in 2015 or thereabouts, slightly before that. And they finally started making these and put them on the market at the end of 2015, and they went from 0 to 72% of the market in the last 18 months.
So do they feel any responsibility to?
They said, oh no, wonderful question. We're not doing this to kids at all, but now that's why they were rated. They have put out a program to help kids stop, but it's just like the program that tobacco companies have put out to help people stop smoking, or kids not using tobacco products, essentially saying, don't use them now, but when you're a real adult, you can use them. And it absolutely don't work. And the ads are all the same, as you can see in the lower right-hand corner. It makes it look healthy, fun, sexy.
And are they getting addicted to this?
And you're one step ahead of me. Well, let me just show you that Juul has gear and vaporware, so you can get a hoodie and actually suck on get your tobacco out of the strap from the hoodie or the strap from your backpack.
So there's a definite marketing strategy.
Absolutely. And actually they come in all, like you can put nice covers on your iPhone, you can get different covers for your Juul flash drive looking stick. And there it comes with.
Trying to make it cool, a thing to do. Get this and be part of it.
Absolutely, and it comes with the 4 pods. The big thing is each one of those pods, different flavor, has the same amount of nicotine as an entire pack of cigarettes.
Wow.
And then it has a USB port that you can plug in, and it's rechargeable, so one charge lasts 24 hours.
My goodness.
And then e-juice for the ones that have to be refilled, not the Juuls, although some are doing it with Juuls on their own, looks just like food. So you see the food products, Nilla wafers and Golden Oreos on the right, and you see the e-juice product called vanilla on the left.
How do they get away with doing that?
There's no rules or regulations. The Deeming Regulations have not been implemented.
So that they can use other marketing for supposed food and put these flavors in there and market it as a food.
They can do whatever they want.
Wow, that's dangerous.
And in the middle, you see a juice box. That's an e-juice box on the left, and a regular juice box with the apple on it and everything, apple juice box on the right, whipped cream, so forth. And just to show that the marketing efforts go along with the use, the red line is regular use of e-cigarettes in the last 30 days, and the green line is the amount of money spent. And the amount of money spent has gone up to about $5 billion a year on marketing, but the industry is now a $55 to $60 billion industry a year. So $5 billion is fine. And I already mentioned about kids in New Hampshire using e-cigarettes or ends in the last 30 days. And this one shows every use, and about 40% of high schoolers have ever used, and it goes up from 9th grade to 12th grade from 20 to 50%. Doesn't matter gender, doesn't matter ethnic background.
And are they using it while in school?
And the teachers noticed this last year, so that we went to the Nashua North teachers workshop last February vacation, because kids are using them. They didn't realize they're doing anything. They're just flash drives. They're sucking on their flash drive, and it doesn't make the big plume of vapor. And they just whatever that does come out, they can blow down their sleeve or down their collar. And they're using them all over, and it doesn't smell like tobacco. It smells like whatever flavor they picked. So it's hard to tell. They're using them in the bathrooms, according to the kids, on a regular basis.
And are we seeing health responses to it? Any symptoms going on?
We're seeing what I'm going to get to next on nicotine. That's the one thing that we do know. What we find, and even found this, even though kids are aware of this now, half of them think juuling isn't vaping, but it is, because it's become a verb. It's so popular. And half of them think there's just flavored water in it.
So they don't know
they don't
that
realize
there's nicotine in it.
And neither do their parents. And that's why they're buying them for them.
I see.
And the real problem is that we've got less than 10% of kids using regular combustible tobacco. We got down a huge amount, and all of them turn their noses up at it. Yet about 20 to 30% of kids who would never have smoked tobacco are going three or four times more likely to go on to regular tobacco, regular combustible cigarettes. And the reason being, it's still a better delivery of nicotine than the ends. And so we're hooking another whole generation. And that brings me to the one thing that we do know. And this is an old slide from the 1990s. Nicotine is an addictive drug. You get it from tobacco. It works in the brain. I won't go into this too much, but it's in the reward center of the brain called the mesolimbic system. There are nicotine receptors, and kids, and once those are stimulated, it then sends a signal to another part called the nucleus accumbens of the mesolimbic system, and it puts out dopamine, which is the feel-good hormone. And that dopamine comes out with anything that makes us feel good. Good food, fun activity, opioids, alcohol.
Laughing?
Laughing, thank you for reminding me of that. But yes, regular exercise, the runner's high. You don't have to be a runner to do that. You just have to exercise regularly. But you get it real quickly with nicotine. And what happens with nicotine, and this is a busy slide, but what happens is, especially for anybody, but very quickly and with very little exposure to the developing brain, and the brain is the last organ in the body to fully develop, is that it makes more cells, more receptors, so you keep needing more and more, and those changes never go back to baseline. So kids' brains, our brains develop by age 25. Girls develop quicker. I'm not sure why, but they do. By the late teens, boys by 20, 25. And we know this from data in the 90s, a few cigarettes, several cigarettes a week, not even every day, for a few weeks, will do the same thing in a developing brain with nicotine as using several cigarettes a day for several months in a developed brain, someone over 25 or 30 years old.
And what does it do?
And what it does, it makes more cells and higher density of these nicotine receptors in the part of the brain that then wants more and more of the substance to be stimulated so that they get this reward afterwards. I have a slide, I think, that shows it. This just shows that it works in other parts of the body, nicotine in the heart, the lungs, the liver, the kidneys, but the brain is the big thing. And what it does is it gives you more alert, better mental acuity, better well-being, and feeling less anxious and stressed. So this feel-good is a real feel-good, and people want it.
And that's the danger in it.
And that's the danger. And other things that are real with nicotine is that it does also affect the hunger. It reduces hunger symptoms. It increases peristalsis in the gastrointestinal system. So about the weight thing that some people have with tobacco is unfortunately real, but of course it does lots of bad things in every other system in the body, heart, lungs, and everywhere else. And the kids are very susceptible to this, and it's been shown, what's been studied at least, every e-cigarette that's been studied has some nicotine in it, even though from an advertising standpoint they can say this is how you quit smoking, from a lot to a less to zero. We haven't found any with zero nicotine in it, because they're making this e-juice from tobacco, and they need the nicotine to get customers, to get someone hooked. So people get hooked by the nice flavors, and it's a neat thing to do. Then they feel really good about it, and then nicotine is metabolized in 2 hours, and in 2 hours, when it goes away, if you don't get more dopamine, you get withdrawal symptoms, which are all these things: irritability and restlessness, depressed, anxious, and so then they self-medicate with more nicotine. And
So it's a vicious cycle.
It's exactly what I'm trying to show there. And I went back to an old, rather than new slide from the 90s. It meets all the hallmarks of an addictive drug, even when people know it's bad for them, like combustible cigarettes. It's hard for them not to keep doing it. And the other thing is it sets them up as a gateway to other drugs. Opioids, alcohol, cocaine, amphetamine were all studied in the 90s, and they went from nicotine inhaled to intravenous opioids, to ingested amphetamines and things of that sort, not the other way around. So we're worried by setting up another generation, we're going to have another generation that's hooked. And we knew back in the 90s that kids who smoked were more likely to use alcohol and marijuana and cocaine. And now we know that kids who use and specifically Juuls are 3 to 4 times more likely to go on to regular combustible cigarettes, because they can still get the nicotine easier, cheaper, and quicker out of a combustible cigarette.
And what about marijuana? Do they use that within those types of vehicles?
That would have to be for another time, but yes, the e-devices that are refillable, they can put any substance in it. They can put cannabidiol, they can put THC in it, they can put different combinations of marijuana in it. Whether they work yet, we're not sure.
But it's going into the metabolism quicker.
Well, this is what happens when you, I'll give you what we do know for a fact, is regular combustible cigarettes, 20 cigarettes in a pack. Each cigarette, a normal smoker takes about 10 puffs on before he's finished it. And within 10 seconds, they get a hit in that part of the reward center of the brain, the mesolimbic system, and get a dopamine surge.
This is regular smoking.
Regular smoking
Inhale.
cigarettes. So within 10 seconds, mean of 6 seconds. And what was found in the 90s, that if you give IV heroin intravenous heroin, it takes about twice as long. Only 20 seconds, doesn't sound like much, but for the brain it's a big deal. And it's twice as fast with the cigarettes. Best drug delivery device we know is the combustible traditional cigarette. The ends aren't quite there yet, fortunately, but the Juuls are getting close. And that's why first e-cigarettes took off, then seemed to flatten out, and now the Juuls are taking off again. And still not as good as a combustible cigarette, so that's why the kids seem to be going on to regular cigarettes when they can't get another pod, Juul pod. You can get refillable Juul pods. So there's a lot of controversy in the medical field about all of the people who started this as a nicotine delivery device for people who couldn't quit smoking with all the pharmacotherapy we have now. But the pharmacotherapy and the other nicotine replacement therapy we have now, made from tobacco products but purified and FDA approved so we know there's nothing else in it, are not as good as the combustible cigarette and maybe not as good as the e-cigarette, we don't know. In England, in the UK, they say it's much less harmful and they have the deeming regulations in place so kids aren't using it and they're finding it's another tool we have to help people quit smoking, but it isn't any more effective than other nicotine replacement therapy that we've found as yet. But for anyone who has used everything appropriately, and not many do in this country, all the tools that we have, the appropriate dose of nicotine replacement, patches, gum, lozenges, inhalers, and so forth, and the other drugs approved, which have been approved since 2008 and before, but what happens is that those people, I'll say, okay, try an e-cigarette if we've used appropriate amounts of the other cigarettes. But again, it's deja vu all over again. The Juul companies come out with a school program to keep kids off of it, but it's not been vetted and it just says keep off of it till you're 18.
So what are the types of symptoms people should be aware of, and how is it going to affect, if it hasn't already, the health, the human body, as it ages and is going through this process?
We don't know. Science takes a long time. We know it affects the brain. That's the only thing we know for sure. Mm-hmm. You can get addicted with it just like you can with any other nicotine.
So is it going to affect your clarity of mind, your ability to communicate, your ability to learn?
Nicotine doesn't do that, but it does make you want more and more of the substance.
So an addiction.
It is an addiction, and it is a gateway, we knew, to opioids and to alcohol. At least that data we have. And we have that data from the 90s with nicotine, and the nicotine ends and e-cigarettes seems to be exactly the same.
So what do we need to do?
Well, we need to get those deeming regulations enforced.
And how does one do that?
It needs political will.
And what does that mean?
And that means we have to get out and vote for those who will put those into place.
And how do we know who they are?
Well, that's what you need to be active and engaged with the people running for different parts of government, right from local all the way on up.
Okay, and so what should people ask of the politicians who are running in order to know that they are supporting this deeming to take effect?
Yeah, say that we need to put these rules in effect to keep kids off nicotine, and so that we can study these products as something that might be helpful for intransigent people who are really addicted already to nicotine by smoking cigarettes, and to help them get off. So we could give it a both. That's really the truth. And we have to stop. I mean, Juuls and Altria, which makes Marlboros and makes I think Mark 10, and other e-cigarette manufacturers are saying they don't want people to be kids to be on tobacco, but at the same time they're obstructing known policy measures like these deeming rules and like anti-marketing and like smoke-free and secondhand smoke-free air. They're obstructing that at the same time they're saying they don't want kids to do it.
What do parents need to know?
Parents need to know that Juuls could be just as dangerous as cigarettes and lead to opioids and alcohol use, and not to buy them for them and not to use them any more than they would want their kids to use alcohol or opioids.
And so what should parents do if they know that their children are involved in it and needing to get off of nicotine?
Well, to get off, we're in sort of a hard place. There are programs out there. Let me get to those. So first of all, we need to get rid of the marketing. We know that nicotine results in control of the brain, and essentially, maybe not forever as much if you're a user, but even a former user is always at risk for any substance. and we need to not make replacement customers, as I call them, for life, because the kids are that. And what we can do is, there's a prevention program called Catch My Breath. It came in through Breathe New Hampshire, but it's a University of Texas program, and it's a standalone that teachers can use to keep kids off e-cigarettes and Juuls. They even call it e-cigarettes and Juul prevention. Breathe New Hampshire has other programs about youth and tobacco use to keep them off. QuitNowNewHampshire.org is a website you can go to, or a phone number that you can call that you can get a tobacco treatment specialist, which 24/7. You have to wait because it's a little bit of a wait on the intake, a 5 or 10 second hold, but they will talk to you about that. So there are a lot of things that are available to get involved with advocacy, so that we don't have a policy out there that that allows us kids to get on these cigarettes. And the FDA did raid the Juul's headquarters earlier this month, and we know the policy works, because the British Public Health and Royal College of Physicians that say it's 95% safer than regular cigarettes, their kids aren't using it. The only people using it in the UK, it seems, in any degree, are people who are already smoking, adults who want to quit and haven't been able to. Turns out it doesn't work a lot better than other nicotine replacement, but it works pretty well. 20, 30, 40% will help quit and stay off. And then you want them to get off that eventually, because it's not harmless. You're still getting products that are probably harmful to your lungs, and who knows about other organs, but not as many as in a combustible cigarette. But the policies work, and that's why we think that kids in the UK and the EU aren't using this, whereas we're having 11% nationally and more than 24% locally in New Hampshire using these on a regular basis.
So to summarize the important information that you want people to know and what they can do to advocate and to help protect the youth.
So the two things to know is that nicotine is bad for kids to get on, leads to other substance use, we know that. To help keep them off it, there's a lot. I have here a list of local coalitions that are doing it, just for the alphabet soup: Department of Health and Human Services, Breathe New Hampshire, Northern New England Poison Control Center, local coalitions like the National Prevention Coalition, and they have them all around the state. Dover's one of the most mature groups that has been around longest, meaning, and working well. Schools are involved. We're going to schools, PALS, Police Athletic League, Life of an Athlete, Boys and Girls Club, YMCA. We're all working together. TFNH is Tobacco Free New Hampshire, the Coop Institute, a clearinghouse for this in the state. Again, we're working together, and we're actually getting it together. It's probably going to be Breathe New Hampshire. That's why I disclosed that a lot of these slides, all of them that have the logo on it, I've taken from Breathe New Hampshire. And it's the oldest voluntary agency in the state. And they actually got a grant from CVS Health, which has its $50 million 5-year commitment to making the next generation tobacco free. And so we're working with them, and a lot of the slides are from them. So any of these groups you can get involved with, and we need to get the word out to parents about what this is doing.
So for further information, where can parents go?
Probably the best is right here, Breathe New Hampshire, as a clearinghouse to get the word out.
So BreatheNewHampshire.org?
BreatheNewHampshire.org or 669-2411.
Area code 603.
Area code 603-669-2411. And we have this program that we put together with they put together with the CVS money called Vaping Unveiled, and we're booking out to January, but we're flexible.
Is there a cost associated with it for this
No cost associated to it. CVS covered that with the grant, or that was part of the grant. And we can get out there and talk to people about it. We need to talk advocacy-wise to our politicians, our legislatures, and the people who are going to vote for it, that they will get the deeming rules passed, and get to the FDA, that they really need to get on top of this. Is it more dangerous than vaping for teens? Yes. For adults, we're not sure. For those who are already smoking, it does affect the brain. And they're just not safe. They're not harmless, but they're maybe less harmful than combustible cigarettes, but they're not harmless. We got to keep the pedal to the metal on combustible tobacco, so that these kids don't go on to combustible tobacco. And I think we can get the job done. We're more organized than we have. The problem is real science takes a long time to vet. as to the control. Dr. Suzanne Tansky up at Dartmouth Hitchcock's a pediatrician in the Coop Institute, and talks about this. She knows brains are affected, and she's pretty sure lungs are. So we have to keep kids off it.
Dr. Budnitz, thank you for a very informative program. We greatly appreciate it. Until next time.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.